going to walk you through a short orientation of the dental treatment station. Looking at it, you'll see the patient chair in the center, the assistant chair on the side, the clinician chair on the other side. There is a mobile light here that you will see that each unit has. They have the Pro Cart. You have your high speed and extra hose, your low speed, your air water, and your 2 suctions. There are motors attached to these. If you could leave those motors screwed on the entire event, and you will just get a new handpiece that slides on. You should not have to twist anything. If you are twisting stuff, you are unscrewing your motor. So please do not do that. Please leave your motors on all day. On the top door of the cart, you've got your instrument transfer tub that has a lid that you can put your cassette in, or any biohazard gauze or anything like that to take to sterilization. You can transport it that way. You have your alcohol bottle, hand sanitizer, and some cavity wipes to be able to clean your unit. In the door of the unit, you've got some tongue depressors and disposable mirrors, all your disposables, air water syringes. Got bib clips, dry angles, mouth props, little tooth savers if you do an extraction, 2 different kinds of floss. You've got some Profi angles and some paste and some pumice, some floss threaders if needed. And you've got your short and your long needles. There is a needle recapping device there. You do have Dappen dishes and some matrix bands, some clear strips and some wedges, some brushes, micro brushes, and of course some cute little rings for the children. We do have Mr. Thirsty suctions. We have 2 different sizes of those that will help isolate and keep the area dry if you need it. Some HVEs. You've got cotton tips for your topical, and you have saliva ejectors. On the top of the unit, you've got a clipboard up there. The red side says ready, the back side is done. So we use those to let the runners know that your chair is clean and ready for a child, or when you finish the procedure, when the runner needs to come and get your child to take them to the next station. There's a couple ink pens attached to the clipboard. That is for filling out your treatment notes on that particular child. You have your sharps container. We have a laptop. The only thing that we do use the laptop for is for viewing x-rays. It's pretty simple. You just type patient name in here, so we will just do test. You'll just click on the patient name. You're just gonna go to the little gray box right there, and you're gonna click that, and if the child has had x-rays taken, they will pop up right there. You can double click on the image to make it larger. And if no x-rays pop up, more than likely they may not have taken any x-rays on that child. You do have a curing light and some sleeves. We do have a trash bag here for non-biohazard waste. In the top drawer, you will have masks for yourself. You will have the patient bib, extra ink pens, some tissues. You'll have your restorative guns here. Some cute little glasses for the kids to wear during treatment for safety, and they can also keep those. If the kids are older, we do have some safety goggles for them. Obviously, they don't keep those. In the bigger next drawer, there is chair covers if you want to use that as a chair cover, and also as a trash bag. And in the back of every treatment cart is an extra bag of some cavity wipes. Everything restorative wise is in your kit here. Most of our supplies are all donated by VOCO. There is a VOCO rep at all of the events to answer any questions that you might have on how to use things. Also, up on your clipboard is a blue folder. It has directions for each of these items of how to use them as well. You have your topical in there, and you have some varnish, articulating paper, some Vaseline. You've got 3 different types of anesthetics. You've got a light body and a heavy body, and some tips. Your packable is here, and again, your gun is in the top drawer. You've got sealant, SDF, tips, bonding agent, and then we've got just hemogel, edge, some Conceptus, and then some desensitizers.